Namaskar and good evening. Welcome to Gyan Pravah, a podcast series episode 208. Today's topic is Health of the Woman in Rural India. And guest speaker is no other than my own beloved teacher, Dr. Professor Manju Gita Misra Madam. So we all know in rural India, women face significant health challenges, including higher rates of malnutrition, anemia, maternal mortality compared to urban areas. These issues stem from a combination of factors like limited access to quality healthcare, socio-economic inequalities, and cultural norms. While some improvements have been seen in areas like institutional births and maternal mortality ratios, a considerable gap remains in ensuring equitable access to healthcare for women in rural India. So today, Dr. Manju Gita Misra Madam, who has worked a lot for rural women, she will be speaking about what is the health status of the woman. First of all, I would like to thank Dr. Sunita Tandulwadkar Madam, who is President of Fogsi, and this podcast, Gyan Pravah series, is the brainchild of her own mind. Sunita Tandulwadkar Madam is head of the department and chief of IVF and Endoscopy Center, Ruby Hall Clinic, Pune. She is founder and medical director of Solo Clinic IVF, a center for excellence in infertility, co-founder and medical director of ELI, Stem Cell Research and Application Center, Pune. She is presently president of Fogsi, president-elect Ishad for 24-26, founder president for the Society for Women and Rejuvenation 2023, and she had authored more than 18 books and had more than 85 publications and has been invited as faculty in 400 plus national as well as international conferences. She has received many awards like IVF Icon of the Year, Endoscopy by Economic Times, Pride of the Foxy 2022, Bharat Gaurav Puraskar, and later appreciation from President of India. Madam is busy, so our Vice President, Professor Dr. Abha Singh will be joining soon. So Madam, Dr. Abha Singh has served Lady Harding College as HOD, and she had done lots of work related to women's health and also for the academic purposes. So I invite Abha Singh Madam. She will be joining. When she joins, she will introduce the gatherings, and she has been serving as Vice President Foxy North Zone, and she has taken many precedent like past President AOGT 2017, past President NARCHI 2015-217, and Chairperson DSC, PCP and DT Committee, Chairperson Safe Motherhood Committee between 2014-17, and she has also served as Vice President Delhi Gynecological Endoscopic Society and delivered many guest lectures and orations and panelists. Her field of interest is pregnancy, laparoscopy, infertility, and oncology. So, Madam was supposed to introduce the guest speaker, Dr. Manju Gita Misra Madam, but anyhow, she has not joined. She is on the way. So, let me introduce my own teacher, beloved Guru, Professor Dr. Manju Gita Misra Madam. She is just like my mother. She has graduated and post-graduated from Patna Medical College and has done DGO MS. She was a teacher for undergraduate and postgraduate at NMCH, PMCH, and has vast teaching experience for more than 40 years. Madam was examiner for undergraduation, post-graduation, and DNB at various universities and appointed as instructor by MCI, a national board for recognition of DGO, MD, and DNB courses in various colleges and institutes. She is a teacher and a surgeon par excellence. Madam has served as past President IMA, All India Women Doctors Wing. She is a dedicated and active member of IMA and had received Lifetime Achievement Award from National IMA as well as IMA Bihar. Madam has served as Chairperson Medical Education Committee in Foxy, delivered orations, guest lectures, and keynote addresses at Foxy conferences at various levels. She has several publications and edited books like Critical Care in Obstetrics, Treatment and Prognosis in Obstetrics and Gynecology. She was organizing secretary of 57th ASCOG in 2014, which held at Patna and was a grand success. Madam is patron and past president and strong pillar of Patna Obs Society. She was Secretary General, Senior Vice President, and President of ISOPUB, and She had also served all India, all Bihar and Jharkhand societies past president, and she is a torch bearer and dedicated faculty for both in Bihar and Jharkhand doctors. She has organized several seminars, workshops, CMEs, and conferences under the banner of Patna Afghani Society, ASOPAV, and IMA, and organized more than 100 rural health camps in Bihar. So, Madam has vast experience about the health of the women in rural India, which we have witnessed when I was a student in her tenure. She has organized camps for promoting OCP and AIDS awareness in Bihar, organized All India Conference of IMA at Patna, and organizing secretary of 57th ASCOG. She has received Lifetime Achievement Award by Fox in 2015, Lifetime Achievement Award by NARCHI, Lifetime Achievement Award by IMA, Lifetime Achievement Award by Times of India, and Lifetime Achievement Award by IGMS Patna. Madam has also glory of receiving awards like Kanak Goyal, CL Jhaveri Family Planning Award, Dr. B.C. Rai National Award, Dr. R.K. Minda Community Service Award, Jagran Health Excellence Award in 2015, and she has been felicitated by Economic Times for her professional contribution in health sector of the women. She is also committee member of Red Cross Society, working with Ayushman Bharat, and member of Central Working Committee of IMA. Her special interest is in high-risk pregnancy, adolescent gynecology, and emergency obstetrics. She has been attending almost all national conferences still at this age, and very keen in attending FIGO conferences as well as other international conferences. Presently, she is consultant at MGM Hospital and Research Center and serving all the women coming to her place, even from rural places. And she also visits rural areas from time to time. And overall, Madam is an excellent human being and always ready for helping colleagues at any situation on both professional as well as personal levels. So with all these words, I request Madam with folded hands to I invite her as a guest speaker for today's podcast, and the question will be answered by her once she is ready. So Madam, you are now ready. So should I ask the question? Before that, you want to say a few words about yourself?
Yeah, thank you, Kavita, for your nice introduction to me.
Please increase your sound. I think it's a bit low. Yeah. So should I start? You are serving the society at various levels, and you are keen to serve the society, especially rural area. So just I want to know, why do women in rural areas face more health problems than urban women? We all know they are very anemic, malnourished, maternal mortality is higher as compared to urban women. So why is this?
Thank you, Dr. Kavita, for your kind introduction and inviting me to this important podcast, which has been initiated by our Fogsi president, Dr. Sunita Tandulwadkar. So I thank you, and at the same time, I thank President Fogsi, Dr. Tandulwadkar, for giving me this opportunity. So now coming to your question, so because of our rural women, why face more problems than urban women? Because they have got poor access to healthcare facilities, lack of health education, poverty, and social barriers such as early marriage and gender equality. So these are the problems, and that's why they face more problems.
Okay, Madam. So you're right. So this is the reason that our rural health, women are still suffering from many health issues. So what are the common health issues for rural women, especially during pregnancy? They are suffering, I think, from childhood to the menopausal age group, but still, just I want to know the health issues which they suffer during pregnancy.
So during pregnancy, they usually suffer from anemia, malnutrition, lack of prenatal care. They don't attend the antenatal clinic regularly. Home deliveries, still home deliveries are very common in the rural area. They get infections, and so there is high risk of maternal death.
Okay. Madam, anemia is very common among rural women. though they live in such places that they have opportunity to eat more and more green leafy vegetables and all these, unpacked food. But still, anemia is very common. So why this anemia is common among rural women more than the urban women? What do you
Because
think?
actually, although the vegetables, they are available in the rural areas, but their diet is very poor. They got frequent deliveries. Usually, at most the time, you will see that they have 3 and 4 children, and the excessive menstrual blood loss without proper nutrition or supplements. That's why the anemia is very common in the rural women.
Okay. So I think you are right. Okay, they are not aware what to eat and when to eat. So that is very important reason that anemia is more common in rural women. And what do you think? What challenges do rural women face in maintaining menstrual hygiene? Menstrual hygiene also not well maintained among them.
Because
So what is the reason?
lack of awareness, unavailability of sanitary products, cultural taboos, and lack of clean toilets and water.
So
Even
government is working a lot in this sector, but
still it is not available in the rural areas.
Yeah, I think when we were students in PMCH, at that time, these problems were more common as compared to nowadays. At the time when we used to visit the rural women, they had many such type of problems. Menstrual hygiene was not well maintained, and they all were not, I think, not healthy in any condition like pregnancy or childhood or even in adulthood. So, madam, what are the dangers of early marriage for girls in rural areas? They are just to mention that many, not more, but many of them still are getting married in rural areas at a younger age group. So, what are the dangers you think?
Pregnancies in the early age, it increases the risk of complications, and there is increased chance of maternal death. It reduces the chance of education and development of the women. They don't know what care should be taken during pregnancy, and that's why they get married at early age, and so at early age they get pregnant and frequent deliveries. So that's why these rural women have got more problems than urban area.
Okay.
And there is more risk of complications during pregnancy, childbirth.
I think nowadays, more and more, especially with this government, like our even Chief Minister Sri Nitish Kumar has started so many occupations for girls, like Jivika and everything. So now they are getting more employed. That's why women empowerment is increasing. And so the girls are getting to be married at least after 18, but still in many areas, still the girls are coming at younger age group when they are married. Like today only I got a woman, she was just 16 years age and married for last 6 months. So I asked them, why you married this girl to such tender age? They replied कि madam, so many accidents, इतना एक्सीडेंट हो रहा है समाज में कि इसके डर से हम 15 साल 15.5 साल की उम्र में ही शादी कर दिए क्योंकि लड़कियों के साथ आजकल इतना सारा कुछ होने लगा है. So still there is taboo, and many girls are getting married at the younger age group. Madam, what do you think? How can reproductive health be improved in rural regions? So
by promoting family planning, providing access to contraception, sex education, and regular health checkup is needed to these rural women.
I think education is very important.
Education is very important.
Because with education and with empowerment, they can think that families should be smaller, and they can, these women can take their career, or they can take their family also in good condition.
They must plan their family at what age married they should get married, and at what age the first child should be born.
Yeah.
But these
So-
are not, they don't know about these things, and that's why there's more chances of complications are there.
So I think education and empowerment, these two are main weapons. With these two, we can improve the health of the woman. We can improve the all these like menstrual hygiene and all other social inequalities, like, and maternal mortality as well as morbidity can be reduced to a certain degree. Why are non-communicable diseases like diabetes, cancer rising in rural women also? Though these are more prevalent in urban women, but still
But
nowadays these diseases are rising in rural women also. So what do you think?
now these days we see that even in the rural women, they get diabetes and other complications. So when they get pregnancy, the complications, more complications, chances of more complications are there. This is mainly due to lack of awareness, and then sedentary lifestyle and absence of regular screening and regular checkup.
Yeah, I think when the baby is in utero, at that time, it's more important that the mother should eat proper food, proper nutrition, rich in all vitamins, minerals. So the 1,000 days which a baby has during pregnancy and I mean in the utero as well as after birth, these are the most important days which decide what they will have in adult, like diabetes, obesity, hypertension, everything. So I think in rural area, they are not aware to take these things, and that's why they are now sufferers. So not only in the urban area, but I think in rural area also, these cases are increasing, both the diabetes, cancer, and other like hypertension and all these cardiac diseases. Madam, I think rural women must be having less mental health issues, but now with increased globalization, they are also having mental health issues. So what do you think? Why they are suffering from these mental health issues? Because they mostly live in communities. They usually meet, greet, and I think they share their thoughts, their work. So, but still nowadays, the mental health issues are being suffered by rural women also, which is more common in urban women. So, what do you think? What can be the reason?
Actually, you rightly said that it is more common in women. Problems. But these days, it's see that even the rural women, stress from poverty and domestic violence is still prevalent, and lack of support and or healthcare access. These are the responsible for the mental health problems in the rural women.
Madam, how does lack of clean water and sanitation affect women's health? So they should have clean water, but still in many places the well gets dry, especially during summer season. The hand pumps has no water when it's pumped, and they have to fetch water from nearby river or pond. So they have many issues. So what do you think? How does lack of clean water and sanitation affect women's health? What are the
Lack
reasons?
of clean water leads to infection. Frequent urinary tract infections also are more common, and then the menstrual problems and waterborne diseases they get because the water is not clean. So that is the main problem.
Sanitation is not well maintained.
Yes,
so how it affects women's health? Hello? I think your network is unstable, madam. It's coming.
देखे तो ठीक है.
Madam, what can be done to improve women's health in rural areas? What do you think?
Actually, we should improve strength primary health care, conduct awareness campaign and program in the rural area, improve their nutrition and hygiene, and train local women such as Anganwadi and health workers and provide mobile clinics. And you must get the benefit of telemedicine and promote government government program which are available to them, such as a scheme like Janni Suraksha Karikram, then Matri Janani Shishu Suraksha Karikram, Surakshit Matritva Abhiyan, and these they should be provided with these facilities. But most of the rural women, they don't know about this, and they don't get the they don't get the this benefit of these programs. So we must do rural, go to the rural area, visit rural area, and educate them. And you must convince them that these programs are available, and these programs are available at the program by the government, so that they can get the proper consultation and proper treatment, and they should be managed properly according to their need.
I think these nowadays Asha and Mamta, they are also helping a lot, because they are given incentives, and they have to bring the women, they have to identify the women, especially during pregnancy, and they mostly bring them to the institution and promote them for institutional delivery. So nowadays, I think scenario has been changed, but still it needs more support and more
scenario has changed. It is much improved than from before, but still it is not so common, and rural women face these problems, and they don't get proper advantage of these government programs which are available to them, such as Surakshit Matrit Abhiyan, Janni Shishu Suraksha Karikram. So actually they don't get benefit of these programs.
Madam, how telecommunication can be used for women health in rural areas? What do you think? So because still like in nowadays, when we have severe situation of flood, so many women are living in those places where there is no facility of transport, neither any road facility or train facility. Sometimes they travel by boat, but still we have many women who say that we have come after crossing the water up to knee or up to thigh. So how telecommunication can be used for improving
rainy
the health?
season? It is very common. Rainy season, it is very difficult for them to reach to the to visit any gynecologist or any doctor, medical. So
I think in this scenario,
during this period, they can get the benefit of teleconsultation with specialists without traveling, saving their time and money at the same time.
So I think they need support from the government so that they can have access to teleconsultation, because it's not easy to get teleconsultation. Many times they don't understand. So how they will contact, how they will get the answer, right answer, and what are the health issues. So should be initiated by government only. Then only they can have the facility of this type of teleconsultation. So,
and some gynecological conditions can be taken care via telecommunication without traveling. It saves time and both money, such as if she is suffering from UTI, if she is having AUB, on any menopausal issue, or about the family planning. These advices can be given on by the telephone. So telemedicine helps women in remote areas. They receive timely and appropriate care. Proper prenatal care can also be advised during this period, such as you can convince them that when you can get first pregnancy, and what should be the interval between the first and the second child. These advice can be given on via telephone also.
So, madam, I think most of the questions have been covered, but still, just I want to know because you are very senior gynecologist and you are serving for last means madam, how much? 50 years? More than 50 years. So you are working in every age and every decade, and you are facing so many problems. So what do you think? How can maternal health and child care be improved in rural areas?
Because you provide health care, access to healthcare services, and by providing access to healthcare services, the maternal health can be improved, and you can convince them and proper advice. So,
madam, just I want to know. I have been a student since MBBS time. I was a MBBS student also under your guidance, and I was a PG student also. So I have seen you. You help a lot to all the colleagues, to all the women. So what promote you? Just is a personal question, madam. बस ये आपसे पूछना है कि आपको कैसे ये लगता है कि नहीं मुझे अपनी colleagues, because in our time we had some strike because somebody has broken one or two flower pots, and you came with us in support of us, and you told कि नहीं ये हमारे बच्चे ही हैं, जैसे हमारे बच्चे गमला तोड़ देते हैं वैसे ये बच्चे तोड़ दिए, उसके लिए इतना बड़ा इशू बनाने के नहीं, because we were asked to that our career may be terminated. Principal, superintendent, everyone was very angry. But you came in support of us. Nobody came in at that time in PMCS, and you came in support of us. कि ये लोग हमारे बच्चे के समान है, जैसे हमारे बच्चे घर में थोड़ा कुछ तोड़फोड़ कर सकते हैं, वैसे ये भी कर लिए. So what promoted you to help all of us?
Actually,
we have witnessed you.
From the beginning, I have got this. I have seen my father. He was also a doctor, and he was working in the rural area at that time. And I have seen him, how he was working at that time when there was no facilities, and how he used to take care of the rural male or female girl, even girl child. So from my father, I got the inspiration, and from that time, I took challenge. I will also serve the community, and I will actually I love my junior colleagues, such as when you were students. I was very much attached to you and all the students who were working at that time.
Yes, madam. Yes.
At present,
yes, madam.
In my hospital, there are DNB students are also there getting training.
Okay, so all right. So many congratulations, madam. So DNB students are being trained under your leadership, under your guidance. So that is a good thing, and most of them will be benefited because you are far excellent surgeon. We have seen you doing surgery like mastectomy and all these surgery. So I think our PG time should be increased. 3 साल से 5 साल हो जाता शायद ज्यादा हम सीख लेते, क्योंकि 3 साल के बाद फिर हमें इधर आना पड़ गया और हम लोग अपने हिसाब से काम करने लगे. Still we need guidance from you, and you are always ready to help us. Madam, I have called you in Munger, a smaller town, twice, and you every time agreed and you came. So thank you so much. You were ready to help us. So just I want to know, if say a few words about you, madam. So you have done a big journey. So I think you belong to Darbhanga. So just you tell me about your personal life, because you have time, so we can talk for a few minutes.
Actually, my personal life, when I was in the school, and when I passed.
Madam, you had studied from Darbhanga?
No.
Then?
Because my father was doctor, and he was working the blood bank of PMCH.
Okay.
When I did matric from Bakipur Girls High School.
Okay, sir.
And from after that, I got admitted in the this Magad Mahila College.
Yes, madam.
And after, because my father was posted in the blood bank of PMCH, he was at Patna for I think for 4 or 5 years. During that period, I did my this.
MBBS.
Matric, then ISC,
yeah.
and then I got admission in the medical college. At that time, my
Okay.
father was here in the blood bank. And when he got transferred, already I came to the hostel, and throughout my MBBS course, I was in the hostel.
Okay. And then you got married and you got settled at Patna.
Patna.
Yeah. So, madam, just I request you to give a message for the junior colleagues like us. So, how can, because nowadays so much jealousy, so much tension prevails among the colleagues. So, how it can be at least uh, just at least decrease, because there is jealousy. Somebody if wants to rise, other will pull. So इसको कैसे कम किया जाए ताकि एक हेल्दी इन्वायरमेंट हो, लोग एक दूसरे का अच्छा सोचे और अपने भी आगे बढ़े, अपनी ही लकीर आगे करें, ना कि दूसरे को पुश करके आगे बढ़े. So
first you have to get yourself promoted. You must be hard. You do hard work, and sincerity is very very important. And then truthfully, you work for the patient. And even if your colleagues are in difficulty, you must help them, because these days it is not possible for me. For many years, I used to go to the different doctors when they are in trouble. They call me during emergency, and I go to them and I help them, all my colleagues. So you must try to help your colleagues.
Yes, madam. This helping attitude should be present.
Yeah.
Because, yeah, then only, because what happens कि doctors एक दूसरे का leg pull करेंगे तो naturally disadvantage is taken by the patients. The patient, leaders, सब लोग उसका advantage लेते हैं. So at least we should be united and should be helping each other.
Helping each other.
Yeah, तभी होगा. I remember एक बार ऐसा हुआ कि आपका ड्राइवर या कोई नहीं आया था, गाड़ी में कुछ प्रॉब्लम था. I don't know what happened. You came by auto. एक ऑटो से आप आ गई थी हॉस्पिटल. सो स्टिल आई रिमेम्बर कि आप इतनी बड़ी गाड़ी में चढ़ के आती थी और उस दिन आप ऑटो से आई. सो आई थिंक दिस डेडिकेशन and this devotion is very important for all of us, and we are born as gynecology to serve the society. We have to take care of both the mother and baby, and we have to work accordingly that our country will be more and more developed, will be more shining. Our Pradhan Mantri also has started this Pradhan Mantri Surakshit Matritva Abhiyan. Yeah, for many years I was also giving time on 9th of every month, but nowadays they have given 2 or 3 days. So it was not possible to attend 3 days, but only one date when 9th was present. जब एक दिन ही करना था, so I used to go the rural areas and I used to serve the society. So I think all these things will help our society, our rural women also, so that their health can improve. And first of all, I think before conception, the woman, whenever any woman comes, even with any adolescent girl, at that time, like in schools, we should make them aware कि अभी से आपको इतना हेल्दी होना, आपका हेमोग्लोबिन स्टेटस ऐसा होना है, आपका डाइट इतना न्यूट्रिशियस होना है, whenever you will be pregnant, you will not suffer from any deficiency. So this is very important. So I think this awareness program and health education should be started at the school level.
Awareness program in the school is very important, because these girls, they must know.
Yeah. So proper. I think we used to read कि 12 at 12 कि 12 साल की उम्र में हेमोग्लोबिन अगर 12 ग्राम किसी लड़की का है तो she will be healthy during pregnancy. So and not only iron, even other nutrients deficiency. Government is giving folic acid and iron, but other nutrients like selenium, copper, manganese, zinc, all these are required during pregnancy in a smaller amounts. So I think education awareness at the school level, this is very important, so that they can think. Also, before marriage, they should be healthy. There should be at least one age definition, like after 18, after 20, you should marry. And after 2-3 years only, you should plan pregnancy. Because this is very important, so that they will be grown up, they will become adults, and they can continue the pregnancy without any complications. And also frequent checkups should be done, not at the rural level, but at the primary health center also, because in sub-center or smaller centers, still doctors are not there. So they should consult to doctors at primary health centers or in big hospitals where if they can afford. So this will make them healthy, and they will reduce these all will help in reducing the maternal mortality, morbidity, as well as newborn morbidity and mortality. So I think this message should be spread. And nowadays, most of the doctors are going to metros. They don't like to stay in the rural areas, even smaller towns. So why? What do you think? Why this happens that most of them after graduation or after post-graduation, they will take degree and will go to
metro town, because they
metro
don't
towns.
they don't like the living standard of rural areas or smaller towns. They want to stay in the metro city.
So I think at least government has made a rule that if they pass from the government college, they do PG degree, they will have to serve the rural society for at least 2 or 3 years. So that is better, so that they can go to rural areas and they can serve the society. So thank you so much, madam, for joining and for giving all the inputs about the health of the woman. I wish you a very good health, success, and your guidance we all need. So I wish you to be very healthy, strong, and always guide us. Thank you so much, madam, for joining.
Thank you, Kavita, for
Thank you. Thank you.